For thousands of years and across hundreds of cultures, the art of breastfeeding has been handed down from generation to generation. What modern medicine has tried to duplicate in infant formula, breast milk has always provided in the most elegant manner. It's the perfect food, always convenient and clean, the correct temperature and composition. Mothers recover from the effects of pregnancy more quickly, and breastfeeding creates a powerful bond between mother and child. Yet, breastfeeding is on the decline. Many women who choose to breastfeed need help and assistance. UNICEF and the World Health Organization have outlined the special role maternity services can play. By following these recommendations, health professionals can help increase the prevalence and duration of breastfeeding worldwide. Once a woman becomes pregnant, there are many things to learn. How best to prepare, getting started, common problems and their solutions, and growing with breastfeeding on a day-to-day basis. And that's what this video is about. A practical guide to the art of successful breastfeeding. All mammals are unique in their ability to produce milk. Cold water mammals like whales and seals need a high level of body fat to protect them from the cold, so they produce a very high-fat milk. The human mammal also produces milk that is perfectly tailored to the needs of its baby. Yet it is only humans that can choose infant feeding methods. To feed the baby with milk perfected over millions of years, or with artificial formula developed by chemists and sold in a tin. To make an informed choice, women and their families need information on both the benefits and management of breastfeeding and the implications of choosing not to. The decision whether or not to breastfeed is nothing new. Throughout history, women have had choices regarding infant feeding. Mothers who are unwilling or unable to breastfeed sent their babies to a lactating woman called a wet nurse. The practice of hiring a stranger to feed and care for one's baby was, however, fraught with danger, and consequently infant mortality was high. Hand feeding with gruel or animal milk was also used, often with disastrous results. The development of infant formula in the 1890s provided a safer method of artificial feeding. In the 1920s, as more and more women began to work outside the home, breastfeeding was abandoned for the relative ease and freedom of formula feeding. Yet, it has always been widely recognized that no formula could ever match the nutritional value of breast milk.
Human breast milk is the ideal fluid for the human infant. It is designed to provide both protection, nutrients, and growth-promoting factors to the immature infant during the time that it is growing. The protective factors in human milk will protect against infection, against allergies, and also against diseases such as juvenile diabetes and lymphomas and leukemia. Nutritionally, human milk reflects the needs of the infant as it matures. In the early days, the colostrum is quite high in protein and low in sugar, which is lactose. But as the infant matures, the milk composition changes to reflect the needs of the infant. In addition, there are factors which promote infant development. The IQ of breastfed infants also has been shown to be increased. This may reflect developmental components provided by the breast milk, which could be certain lipids which are present in breast milk and absent or very low in cow's milk or a formula.
I've had 6 children, and they've all been given breast milk. That's always been very important to me, to breastfeed my children. It's convenient, it's inexpensive, and I believe it's the best thing for them. Health professionals need to consider the impact that they have on breastfeeding mothers. When our first daughter was born 7 years ago, I noticed that in the nursery and around the bassinets, the formula was readily displayed as an available option to mothers in hospital. With our set of twins that was just born 2 months ago, I never saw any formula available in the hospital. It was there, but it wasn't staring me in the face. I was always very committed to breastfeeding my children and didn't have any trouble doing that. But I could see that if I had come across some difficulties and the formula was there and available, I may have been more inclined to seize the moment and put them on a bottle a lot sooner than I did.
Compared to the aggressive advertising of artificial infant formula, breastfeeding remains relatively hidden in our society. A prenatal examination during the last trimester is an ideal opportunity for expectant mothers to receive clear and accurate information on the art of breastfeeding. It also provides the perfect opportunity for physicians to assess lactation ability and identify risk factors.
It's very important, Jane, to have your breasts examined while you're pregnant, just to make sure that your breasts are the sort of breasts that babies can latch onto easily. When a baby breastfeeds, he has to grasp the breast about here and take a big mouthful of breast. Now you've got very easy breast tissue and you've got a little bit of colostrum in preparation being made already.
Okay. At maturity, the female adult breast consists of fatty tissue with a rudimentary ductal system. During the first weeks of pregnancy, the breasts visibly enlarge as the placental hormones estrogen and progesterone, combined with prolactin, increase and contribute to the growth and development of the breast. The nipple areola complex becomes increasingly sensitive and graspable. By the end of pregnancy, the breast consists of about 15 to 20 separate lobules arranged around the areola and nipple. Each lobe consists of branched lactiferous ducts and small glands called alveoli. Tiny muscle fibers called myoepithelial cells surround the alveoli and small ducts. Almost all mothers and babies can lactate and breastfeed successfully, but there are a few maternal and infant factors that can interfere. Flattish or inverted nipples, unusually shaped breasts, breast surgery, previous breastfeeding difficulties, maternal illness, gestational diabetes, pregnancy-induced hypertension, or exposure to HIV or other infections should all be considered risk factors. And women are less likely to successfully breastfeed if they lack motivation or support, have a low socioeconomic status, abuse drugs, alcohol or nicotine, or who are single. And risk factors arise if mother and baby are separated for any length of time, for reasons that might include illness, prematurity, multiple birth or difficult delivery, congenital or facial abnormalities, or cardiovascular or respiratory problems.
When I was pregnant with our first child, I noticed that pictures you'd see of women breastfeeding in magazines and photographs, they would always seem so relaxed and the situation so serene. Certainly it can be that way, and breastfeeding is a wonderful time to be able to sit back and spend that time with your new baby. But it can also be very difficult and very demanding physically and demanding on your time. I think the more information you have before your baby's born, the more prepared you can be to overcome some of the obstacles and some of the problems that can arise in the first few months of breastfeeding your baby.
Pregnancy is an exciting time as a couple starts the transition to parenthood. There is much to learn. A prenatal class offers an ideal opportunity to explore a woman's attitudes and beliefs towards breastfeeding, as well as a chance to learn practical skills.
Prenatal class is an excellent time to dispel myths that many people have about breastfeeding. And some of these include concerns that they do not have enough milk, that their breasts are too small or they're too large, or colostrum isn't good for the babies, or that babies will sleep through if they're fed something other than breast milk. Prenatal classes is a good opportunity to provide information to correct these myths. It's a time that families need to understand that breastfeeding involves a lifestyle and a commitment. Does anybody have any questions or concerns?
I have one question. That my mom, she didn't have enough milk for me. I don't know if I can successfully feed my baby or not.
Yes, you can successfully feed your baby. Breastfeeding works on supply and demand. So the more you put your baby to breast, the more milk your breasts produce. When a baby latches at the breast, there's a message sent from the mother's breast to her brain and back to the breast again. And this encourages the tissues in the breast to produce milk and to let that milk down as the baby is nursing. When you latch the baby at the breast, you want the baby to latch well onto the breast and well beyond just the nipple. You want the baby to latch over the areola and really have a nice wide open mouth when they go on the breast. When you put your baby to breast, for most of you, the first time you do it will be lying down, but eventually when you're able to sit up, you'll find it easier to latch the baby at the breast.
Helping women and their families make decisions about infant feeding and to prepare for breastfeeding starts early in pregnancy.
And that they don't really have much of a role in it.
As we have seen, maternal psychological health, biological health, and social health all contribute to successful breastfeeding preparation. This can lead the way to many months of breastfeeding. But expectant mothers and their families should learn as much as possible before their babies are born, because learning new concepts and skills can be difficult to grasp afterwards.
Okay, here comes another one. Good girl.
Which is what we talked about 2 days ago.
Good girl, here it is coming.
The boy. He's a boy.
Oh, he's hairy.
While a new mother is in hospital, her goal is to initiate lactation and establish successful breastfeeding. As we will see, a number of factors can help achieve this. All mammals are born with a powerful urge to suckle. If left alone, the young are usually able to locate the nipple and begin suckling. Breastfeeding is a natural progression of childbirth. Newly delivered and put to his mother's breast, the baby hears his mother's familiar heartbeat, her breathing, and her familiar voice. Her face is right there too, 8 to 10 inches away, the distance babies see best. Following a normal, unmedicated delivery, newborns are most receptive to breastfeeding, and mother and infant should be left alone in skin-to-skin contact as soon as possible to allow the process of breastfeeding to begin. Immediately after delivery, the baby lies quietly on his mother's chest. He may open his eyes and begin to explore with his mouth. As the minutes pass, he becomes more alert and starts moving his head, arms, and even body, and gradually works his way up towards the breast and nipple. Once the nipple is located, he roots around, opens his mouth wide, and attaches. Early first attachment of the baby to the breast is vital because the instinct to locate and latch, though powerful at first, fades with time, so that a delay of even a few hours may mean the infant will need coaching to suckle effectively. It is the immediate and frequent suckling by the infant that triggers milk production. Following the delivery of the placenta, there is an abrupt decline in estrogen and progesterone levels. Suckling causes a surge of prolactin from the anterior pituitary gland. The prolactin receptors located on the alveoli are blocked by progesterone during pregnancy. Following delivery, progesterone levels drop and the prolactin receptors are open to respond to the surges of prolactin released by suckling. The more prolactin released, the more receptors become primed and more milk is produced. Milk is produced within the milk cells of the alveoli and slowly collects there. If infants do not have frequent access to the breast within the first few hours and on into the first few days, prolactin levels remain low and fewer receptor sites become primed. Unprimed receptor sites shut down, leaving less active sites for milk production. Early first attachment is important for 3 reasons. Immediately after birth, newborns are most receptive to suckling, which triggers milk production. Another very important reason for early first attachment is colostrum.
Colostrum is the first fluid secreted from the human breast. Its production starts soon after birth and continues up to about 4 days after birth. Colostrum is a unique fluid because it contains protective factors absent in the infant at birth. The important component is secretory IgA, which in the adult human coats all of the mucous membranes of the body, the digestive tract, the lungs, and the urinogenital tract. But the human infant is born without any secretory IgA, which protects as a barrier to all of the microorganisms which would enter the body from any orifice. By putting the infant to the breast as soon after birth as possible, the infant is then protected through the digestive lining is protected by the secretory IgA to form the first barrier to possible infection by microorganisms that would enter from the environment.
The hours and days following childbirth are a time for mother and child to get to know one another. Having initiated lactation following delivery, ongoing milk production must be maintained. Rooming in is now recognized as one of the most important features for the establishment of exclusive breastfeeding. Close contact between mother and child enhances bonding, which occurs after birth as the nursing couple begins to get to know one another on a deep psychological level. Rooming in allows mothers more time to better know their babies and recognize their cues. As a baby moves from sleep to a quiet awake time, he may signal his readiness to feed by looking around, moving his mouth, and sucking his fingers. If these hunger cues are missed, the baby may become more distressed and cry. A baby whose cues are responded to promptly and correctly learns two things. He learns that his simple cues produce a response, and this gives him a sense of power and security. The baby also learns to trust that hunger will be followed by satisfaction and distress by comfort.
Our first daughter was born by cesarean section, and I had no experience with breastfeeding, obviously. I remember the first time I was able to nurse her was in the recovery room, about 2.5 hours after she was born. I wasn't clear about the process, about when I could nurse her, when I'd be able to have her with me. And I remember the nurse coming to me with her, asking if I was ready to feed her, and it being so exciting for me because it was, yeah, sure, I'd love to. And we put her on, and the nurse helped me, and she latched on right away. She only fed for maybe a minute, but it was so wonderful, and it was the beginning, and it just kept getting better from then on.
In past societies, positive images of breastfeeding were common, and young girls often developed a confidence in their own ability. This statue from the late 19th century beautifully illustrates a baby placed at its mother's breast. Note the natural position of her hand supporting the breast. Most infants are born with the urge to locate the breast and suckle, but many mothers must be taught the art of breastfeeding.
The reason your nipple is sore, Una, is because the baby is sucking like this. And in order to protect your nipples and get lots of milk, she needs to be sucking like this. And also, she's so bundled up that she can hardly get close enough to your body to nurse well. So let's take her blanket off. All right.
Following first attachment after delivery, mothers should be reassessed 6 hours postpartum.
There, she's already becoming a little bit more alert. And then we'll put a pillow under your arm, and we're going to have you hold her in a football position so that you have more control of the position of her head, and you can get a good grasp on your breast. Because what we want to happen is that all of your areola, or a good portion of it, is in her mouth. All right, now under your arm, your right arm, with your hand along her back and your hand supporting the base of her head, your other hand is going to hold your breast so that all the fingers are beneath and your thumb on top. And tip the nipple down slightly so that it's towards her mouth. And then you bring it close enough so that your nipple tickles her mouth. Just wait a minute. Wait till she opens her mouth really wide. Really wide. And then you need to bring her in quite quickly. That's it. Does that feel right?
Yeah, it feels
Is that a
much
little
better.
better? She's a little sliding off. I think we should just back off a bit again and try that once more. Just raise your arm a bit here. Now you bring her close and wait for a big open mouth. She's starting. Just wait a minute. That's it. Oh, I like the way you're holding her head because you've got your hand supporting her back and you've got just enough of her head to control the angle of it and keep it pressed into your breast. She's not big enough yet so that she can hang on herself. And so your support there really helps. Now when she's sucking, there's some now. You can see your breast tissue moving. See that? And if you look at the side of her head, over here, you can see a bit of action right up here by her jaw. And if we could look under her chin, we can even see her lower jaw rising and falling rhythmically.
When a baby is correctly attached, he shapes a teat and draws the breast tissue towards the back of his palate. This triggers a suckling response, The jaws compress the lactiferous ducts, and the tongue and the cheeks help to draw out the milk. The stimulation of the breast also triggers the milk ejection response. Oxytocin from the mother's posterior pituitary gland causes the myoepithelial cells surrounding the milk glands to contract and squeeze the milk out through the ducts and into the baby's mouth. The infant then swallows each mouthful in a coordinated manner. When an infant is incorrectly attached, he is unable to form a teat or trigger a suckling response. The tongue compresses the nipple against the hard palate and rapidly causes it to become sore. When the baby is repositioned, the nipple is so far back in his mouth it cannot be damaged. The baby is better able to form a teat out of the breast tissue and is therefore able to breastfeed more effectively. In review, we see that the mother sits comfortably and uses pillows to bring the baby up to the level of her breast. The baby is placed facing the mother's breast. When the baby is placed in this position, her mouth lies on a horizontal axis. The breast is grasped, shaping it like a C. This shapes the breast to match the same axis as the baby's mouth. The mother's other hand supports the infant's shoulders and head. The baby is brought close, allowing the nipple to tickle her lips. When the baby opens her mouth really wide, she is pulled quickly onto the breast. The lips are flanged and cover most of the areola. The jaws move in a deep, rhythmic manner with clear-cut pauses, swallowing, and breathing. The football hold is a good position for mothers and babies just learning how to breastfeed, or for mothers who have delivered by cesarean section. Another comfortable position is across the lap.
Celia, to do the modified cradle hold, we need to start with a footstool. As you sit in the chair, just raise your feet here. That's good. And put the pillow under the baby to bring her up to a good level. And I'd like you to unbutton your front there. And we're going to unbundle the baby as well. Now, do you want to just lift him a bit while I remove the blanket? That's it. Oops. Now, what I'd like you to do is hold him so that your left arm is along his back, straight along his back, and he's going to be belly to belly with you. All right, and you can hold your breast in a U shape. That's right, so that no fingers are touching the areola. That's right. Bring him close.
When the baby is held across the lap, his mouth lies on a vertical axis. Holding the breast like a U shapes the breast to match the baby's mouth and makes it easier for him to grasp.
Now, we want his hands to be on either side of your breast, and that hand needs to be back still further. That's better. Good. Now, bring him close enough so that you can tickle his lips with your breast. Normally, this will stimulate him to root, to open his mouth. Connor, there's the nummies. Come on, fella. That's it. Just tickle his mouth with your breast and wait for a big, wide, open mouth. That's it, and press him on. That's it. Press him on and just hold him there until he gets working. And then when you see that his jaw is moving rhythmically, you know that he's sucking well. Just to mention the points about the position you have, your arm is right along his back, and his bum just tucked in there at the crook of your elbow, and you're just supporting the base of his head with these fingers, and you're holding your breast so that the areola is not being touched at all by your fingers. Now you can see how he's positioned with one hand on either side of your breast. His upper lip is flanged up and his lower lip down. That looks excellent, and I can actually hear him swallowing. Can you hear him going? There's none right now. You know, this often happens. When the baby is feeding from one breast, the other breast leaks.
Oh,
Because your hormones are causing it to push the milk out.
How do I know when he's had enough?
Well, he'll usually let you know by just stopping sucking for one thing, And another thing, he might just let go, gradually slide off your nipple. So if you just relax the pressure behind his head, you can see what happens to his mouth. Now you can see he's about ready to slide off. Right.
Parenting starts at birth, so mothers should be encouraged to assume this role as soon as possible.
Everything's good. Your vital signs are good right now. So baby's hungry. You want to feed the baby? Okay. I can just turn you on your side, and I'll help you get comfortable. We'll go on to the left side. Now, I've got this little pad. I want you to support your incision across there, and you're just going to turn nice and slowly. That's the girl. That's excellent. Bring your shoulders over this way a bit. Nice and slow. That's it. Now, do you need a pillow between your legs just to support your legs a little bit? That's the girl.
Breastfeeding is especially beneficial for mothers who have delivered their babies by cesarean section.
Okay, Dad, you want to take
The increased movement aids in healing, and the oxytocin released by suckling helps the involution of the uterus.
He looks hungry, doesn't he? And I'm going to fix this pillow, so, okay, just under your head so that you can see the baby as well, okay? Just rest back. You have to be nice and relaxed and comfortable. Is your tummy okay? Yeah. It's comfortable? Okay, now just wait for a minute. Just wait. Okay. See how hungry he is? Oh, we'll just lift this arm up a bit. That's the girl. Tuck this. And just let him root a little bit and find your nipple. And when he opens his mouth, you wait for him to open nice and wide.
The fluid requirements of a healthy newborn are minimal for the first few days. Infants ingest 7 to 20 mils of colostrum per feed initially and do not require extra fluids. But the successful initiation of a milk supply versus resorting to artificial feeding in hospital is often accomplished by sorting the good advice from the bad.
Just finished feeding and he's hungry again. I don't know what else to do.
Maybe I should take the baby into the nursery for a bottle. You probably don't have enough milk.
Many women abandon breastfeeding in the mistaken belief that they don't have enough milk. This is often supported by well-meaning but misinformed friends, families, or health professionals who suggest supplemental bottles as a harmless relief. But let's look at how supplementing can interfere with milk supply. When a mother exclusively breastfeeds, her milk supply is perfectly tailored to the baby's demand. Supplemental foods, introduced before her milk supply is established, may interrupt this delicate balance. Supplements satisfy the baby's hunger, but the breast doesn't get drained, and milk stasis and breast engorgement result. This may lead to further missed feeds, as the baby has difficulty latching onto an engorged breast. Suppressor peptides in the breast, which are usually removed by suckling, are allowed to build up, and the supply drops. As well, introducing a preformed rubber nipple may interfere with the infant's ability to grasp and shape a teat at the breast. He may then have difficulty breastfeeding.
Hi, Julie.
If frequent efficient breastfeeding is not possible, then mothers should be shown how to express their milk.
Your milk ducts come down all the way around your breast like the spokes of a bicycle, and the milk collects in sinuses way back in here from the nipple. Cup your breast in your hand with your fingers underneath and your thumb on top. Okay? You don't want to be doing it right close to the nipple. You want to be back a little bit. And what you're thinking that you want to do is you want to press your thumb in to reach your fingers. So very gently just press in. That's it. And it's just a gentle pressure. Press in and down. That's it. Great. Super. And you'll notice that sometimes the milk sprays out of just one duct and sometimes out of several. When women are first learning how to express their breasts, it seems difficult, but with practice you'll get quite good at it. And in fact, some women find that they can hand express much easier than they can express with a pump.
Electric breast pumps are fast and efficient and more practical for long-term pumping.
Fit the breast flange comfortably against your breast, that's right, and slowly increase the pressure. The pump is mechanical, and you can help it by using your hand to help bring the milk down a little bit. Yeah, see, you can see how it makes it squirt. The other thing, you could grab hold of it here and get your other hand up in underneath and help the milk come down. That's right. Great.
If breasts become engorged, hot compresses, showers, and expressing milk will soften the breast enough to attach the baby.
They're not quite as far engorged as sometimes breasts can be.
They're going to get worse?
But, well, they might not, because if you feed the baby well enough, frequently enough, and empty your breast, well, they should be fine. What we'll do is put some hot compresses on.
Oh, okay.
And that helps to get the circulation going, soften the tissue down, and then the baby's more able to grasp your nipple.
Oh, okay.
This is nice.
In her short stay at the hospital, a new mother needs guidance at every opportunity. Once home, unprepared and alone, she may feel inadequate. By gaining breastfeeding skills during her hospital stay, she will be more likely to succeed afterwards.
Our third child, Jacob, ended up in the intensive care unit at the hospital and only lived for 1 month. I wasn't able to breastfeed him, but was able to express my milk and have the hospital staff tube feed it to him. It was really important to me at that time that they encouraged me to do that, and that it was a hospital policy for them to be able to give him my milk. It helped with the bonding between he and I, and there was very little I could do for my son as a mother. Being able to give him my breast milk made the whole situation a lot easier for me and made me feel that in some way I was contributing to what was happening.
Megan, this is our breastfeeding policy and protocol book I was telling you.
Every facility providing maternity services should have a policy that is routinely communicated to all healthcare staff. And all healthcare staff should be trained in the skills necessary to implement this policy.
Here. These ones you've probably done before.
By the time a new mother leaves the hospital, she should have learned the skills of breastfeeding and initiated lactation.
I know breastfeeding went really well for you. You know the community health nurse is going to come. Just if you have any troubles, she's a good resource for you. I also have some pamphlets here about other resources in the community to help you with breastfeeding if you should have any troubles. Okay?
Thank you.
You're welcome. All the best.
Thanks.
Breastfeeding is a dynamic and delicate interaction between two people, mother and child. As we have seen, following successful prenatal preparation and a normal delivery, lactation is initiated when the baby is put to the breast immediately after delivery, and it is helped by frequent suckling. Milk is removed by the baby using a correct breastfeeding technique and facilitated by the milk ejection reflex or let-down reflex. The baby's milk intake and growth are determined by frequent baby-led feeds and the avoidance of additional bottles. All of this results in the successful establishment of breastfeeding. When all goes well, breastfeeding is a richly rewarding experience, but problems can develop that interfere or interrupt breastfeeding, and that's what we're going to talk about next. Hospital stays are short, and a mother may feel overwhelmed by her new baby before breastfeeding has become fully established. Many mothers experience the same problems that women faced in the past. insufficient milk supply, infant colic, and breast discomfort.
I've just finished weighing Jessie, Teresa, so you can hold him for a while. And I just would like to review your history with you. I understand he's 3 weeks old, and the weight indicates he's below birth weight. And I remember you saying that he had a bit of trouble during birth and swallowed some meconium, so he had to be put in the observational nursery for 24 hours. Is that right?
My breasts got very engorged, and Jessie had a hard time latching on, and my nipples got really sore. But fortunately, he was pretty sleepy, so he didn't want to feed very much.
I see.
As in any other area of medicine, problem solving starts with a detailed history and physical examination of both mother and infant, including breastfeeding history and observation.
And there's the milk there. Just going to slip my finger in Jessie's mouth. What a good suck you have, Jessie. You sure look worried, though. Man, you're sure hungry. Now what I'd like you to do, Teresa, is to show me how you breastfeed Jessie at home.
Okay. Here you go, Jessie. Here you go.
It looks like Jessie's just on the tip of your nipple there. How does that feel?
It hurts.
What I'd like to do now is just show you a different hold that I think would help get a little bit more breast tissue in Jessie's mouth and take away some of that discomfort. What we're going to do is get a stool for your feet. What we'd like you to do is put a pillow on your lap to support your baby, like that.
Okay.
I want you to turn your baby so your baby's chest to chest rather than lying on his back. And I want you to use, that's right, this arm to support his back and shoulders and just the bottom top of his head there. And then there's a different way I'd like you to support your breast, and you come up from underneath like that. That's it. So you're forming the shape of an oval there. That's right. Then what you do is you take your nipple and you just tickle the lower lip of your baby, and you wait for a wide open mouth. And when you see that, you lift the baby towards your breast very quickly. That's it.
Yeah,
Feels better than the other one?
Yeah.
Mm-hmm. Teresa, I'd like to show you what your baby's doing by using this model that we have here. When you were using the hold that you use at home, your baby is just sucking here, just behind the nipple, and that causes it to be painful, and not very much milk comes out. With this hold that we've taught you, with the wide open mouth, the baby gets well back here, and then is able to milk the ducts where the milk is. And you see the difference?
Yeah.
And by effectively draining your breast, it encourages your body to make more milk. And we've been watching him for a while here, and I've seen quite a bit of sucking, but haven't heard very much swallowing. So that usually indicates that the breast is pretty well drained of all the milk. These are crying.
A second test weight revealed that Teresa's baby took only 28 cc's, or 1 ounce at that feed.
Teresa, what I'd like you to do is, after you've breastfed, is to pump your breast. And what that will do, will take out any little bits of milk that are left, and also the extra stimulation will help build up your milk supply. I want you to use effective breastfeeding techniques like we've shown you here. And I want you to feed your baby at least 8 times a day. And that really means not letting your baby sleep for any longer than 4 hours. Then you have to wake your baby up. And because your baby weight is low, after you breastfeed, what I want you to do is either you or your husband to give the baby some extra fluid, either your breast milk that you've pumped or some formula. And you give whatever your baby wants.
Okay.
The insufficient milk syndrome is caused by either a low rate of milk synthesis, inefficient milk removal, or inadequate milk intake. Let's examine Teresa's medical history to determine why. Mother and baby were separated shortly after birth, when it was suspected the baby had swallowed meconium during delivery. A 24-hour delay in starting breastfeeding interfered with the initiation of lactation. Long intervals between feeds, because of a sleepy baby, led to breast engorgement, which made it hard for Jessie to grasp the nipple, and ongoing milk production was reduced. Because Teresa was unsure how to correctly position the baby, this led to inefficient milk removal. All of these led to inadequate milk intake and failure to thrive. Management includes increasing milk production by increasing stimulation and drainage of the breast, improve milk removal by the baby using a better breastfeeding technique and expressing residual milk, and increasing milk intake by increasing the frequency and duration of breastfeeding and offering complementary feeds. Complementary feeds should be given, if necessary, using express breast milk or formula, as much as the baby wants, after each breastfeed, given by a support person. A bottle is the most familiar method, but supplements can be given using a cup, spoon, or dropper. The supplemental nursing system is an excellent way to offer supplements. The baby can drink extra fluids while continuing to breastfeed. And what's more, the nursing relationship can be maintained. At 11 weeks old, John is a thriving 10-kilogram baby. Yet it seems to his exhausted parents that he is constantly fussing, crying, and never sleeps peacefully. Whenever he cries, his dad hands him over to his mum, who feeds him. The feed is rapid. John chokes and splutters as the milk pours into his mouth, and after only a few minutes, falls asleep, only to awaken a short time later. Nothing his parents do will distract him, and the cycle of short feeds, interspersed by short sleeps, repeats itself endlessly.
Cindy noticed how John pulled off the breast. That's very common behavior of babies when mums like you have too much milk. What I'd like to do is show you how much milk you have. And when the baby first goes on and he starts to suck, the milk squirts out like that, and he finds that really difficult to deal with. What we suggest you do is, in order to prevent that from happening, is to spray off a little bit of the milk before you feed John. And that'll take away some of those strong sprays. Another thing that we suggest you do is to feed your baby in a slightly different position. So if you just pick John up and then you tuck your baby's legs underneath your arm and kind of make a little spot in the little seat in the pillow for him. The reason this position sometimes helps is the baby is sitting upright, and when the sprays go into his mouth, that they're hitting the back of his throat in a slightly different position and make it a little easier for him. Now, I don't know if you've noticed how John is sucking at the breast, but initially the babies go on and they suck, 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 swallow, suck, 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 swallow, and then you have a letdown where the milk just pours into his mouth and he has to suck, swallow, suck, swallow, suck, swallow at a very fast rate. And that, when that happens, John can't manage the milk flow and he chokes and gags. There we go. Was the milk coming out too fast and you need a burp? Okay. That's better, isn't it, John? You're looking a lot happier. Yes, you are, and even a smile. See? But are you still hungry? You got your fists in your mouth? That's often behavior that indicates they might still be a little bit hungry if their fists are in their mouth. Okay? Now, another thing we usually suggest for mothers who have a lot of milk like yourself is to continue to use one breast for each feed. The milk that comes out initially is like skim milk. They call it foremilk. And with the letdowns that come down throughout the feed, the creamy hind milk comes out. And it tends to be richer in fat. And that milk tends to fill the baby up and helps them to grow and makes them feel full, and therefore they sleep longer in between feeds. Oh, there, he's come off. And that usually means when they pop off like that spontaneously, that they're quite often they're full and they don't need any more. Are you full, John?
Cindy is a mother with a naturally abundant milk supply. Whenever she feeds John, the rate of milk removal is very rapid, and hence the choking and spluttering. John is very fussy and cries often. His parents misinterpret this behavior and think their baby is still hungry and feed him frequently. The rapid flow of foremilk has a low fat content, but a large volume of lactose. This lactose is incompletely digested and results in typical symptoms of lactose overload: gassy, colicky babies with watery, explosive stools, and occasional diaper rash. John is suffering from the infant hyperlactation syndrome. Management goals are simple: reduce the quantity of milk drunk and increase the quality of the milk. This can easily be achieved by decreasing milk production, by reducing the frequency and duration of feeds, decreasing the rate of milk removal, by expressing milk before feeds and feeding in an upright position, and decreasing milk intake by using one breast per feed. These simple measures often solve the mystery of colic. As the breastfed baby grows and parents' lives slowly return to normal, the pattern of breast use may change and lead to problems.
Hi, this is Aya St. Pierre calling. I feel really bad right now. I feel really sick right now.
When Aya returned to work and her baby began to sleep through the night, she began to breastfeed irregularly, and this resulted in milk stasis and blocked milk ducts. They remained unrelieved, and she developed mastitis. A mother who complains of a very sore breast or segment of breast, in conjunction with a high fever, flu-like symptoms, and a red area on the breast, has developed mastitis. Mastitis can develop when a mother with an abundant milk supply misses a feed or fails to drain a segment fully. Milk stasis can occur, which leads to blocked ducts and sharp, shooting, knife-like pains in the breast due to ductal cramping. If this area is not adequately drained, the milk may become secondarily infected, leading to mastitis.
Not feeling any easier?
An electric pump may help drain the overfull segments of the breast. Sometimes a small white dot becomes visible on the nipple. It represents a blocked nipple pore. A sterile needle is used to lift off the surface of the blister and open up the duct. Manual stripping can then be done. slow, steady pressure is applied to the breast and the milk is gradually stripped out.
You have to put pressure over the area that's blocked.
Milk stasis, blocked ducts, inflammatory and infectious mastitis, and breast abscess are all part of the spectrum of the maternal hyperlactation syndrome. It can be prevented if mothers are taught correct breastfeeding technique, if infants are fed on cue, and encouraged to drain the first breast completely before switching to the second side, in combination with the avoidance of breast milk substitutes and missed breastfeeds, and regular checking of each breast for early signs of milk stasis. The use of appropriate antibiotics may be necessary in the case of infectious mastitis. Difficulties at this stage shouldn't signal the end of breastfeeding. Correct breastfeeding advice is vital to overcome the problems we've seen and to help deal with other problems that society unconsciously sets in our way. Maintaining lactation in a society that is less than supportive to breastfeeding mothers can be challenging. The next part of this program takes a look at how some mothers have met that challenge. Once breastfeeding has become fully established, many women continue to breastfeed for months, sometimes years. The World Health Organization recommends that infants be breastfed exclusively for the first 6 months and that baby-led weaning should occur in the second, even third year of life. Yet, less than 1 in 10 mothers follow these recommendations. Lack of support, embarrassment, and inconvenience, particularly associated with returning to work, have been found to be the major stumbling blocks. Maintaining lactation is a challenge. As we will see, many women overcome these challenges and with minor lifestyle adjustments can continue breastfeeding for as long as they wish.
When I was in the hospital, it was a very emotional thing because Nathan had jaundice and it kept going up and down, so it was really frustrating for me. When we came home, it was really good. He was really content. He slept and he ate, and that was about it. The breastfeeding is going really well, although at times it's like he's constantly on my breast, either to eat or to suck. His feedings are about two hours, and sometimes it's even shorter. I feel like he's always on me, and it's not as easy as some people think.
Hi. Hi, Pam. Hi, Pam. I'm Annie. I'm a community health nurse.
Hi,
and
Annie.
Oh, he's sleeping there, eh? Well, I'm just going to visit you and see how you're doing.
Newborns lose up to 10% of their birth weight, but have usually regained it by the 3rd week. Normally, babies continue to gain between 20 to 30 grams daily. Birth weight is doubled at 5 months and tripled at 1 year.
Last time was 21 inches. And see, he has grown. Can I get you to Hoa? He must be really anxious about, his weight. I think I weighed him 2 weeks ago, and he was 7 pounds 8 ounces. And this week he's 8 pounds 7 ounces.
Great.
And I'm just going to show it to you on a growth chart here. And what this growth chart means is it compares his weight with other babies in the same age group. And he's 21 inches long, and he's right here. The solid line is the 50th percentile, meaning the middle point, okay, meaning 50% weigh less, 50% weigh more. So for him at the 1 month mark, he was between 25 and 50. So he's pretty right on in the middle. Quite well proportioned for his height and weight. And you mentioned to me earlier that you were saying that you're staying up to breastfeed and baby is really irregular with his pattern. You know, are you getting enough rest?
Yeah, I am. I usually do the night times, and then Tom does the mornings while I sleep.
Tom is helping. Oh, that's really good to see. Dad is right in there, right? Yeah. That's really good that, you know, Dad is involved and having that extra pair of hands really come in handy. Yeah.
He sleeps beside my bed, so I usually hear him when he's starting to wake up, and I'll put him on my breast and I'll lie down and I'll either go back to sleep or I'll talk to him.
Parenting is tiring. It's important to try and rest when the baby naps. Many women find it easier to have the baby in the same room or even the same bed during these early weeks. By 6 weeks, the milk supply is usually fully established and most, if any, feeding problems are overcome. At this age, babies will generally feed 6 to 8 times in 24 hours. Maintaining good health depends on adequate rest, fluid intake, and proper nutrition. Just as an expecting mother avoids alcohol and caffeine, so should the breastfeeding mum. Women who breastfeed need extra calories, many of which have already been stored up during pregnancy. It's important to choose a variety of foods from the 4 food groups. Just as an optimal diet for the mother is important, so does the baby deserve the very best. Breast milk provides not only perfect nutrition for the growing child, it also contains over 100 biologically active ingredients which stimulate the growth and maturation of the brain, eyes, kidneys, and other endocrine organs. Close contact also allows a mother to protect her child against many common illnesses. Kissing and cuddling passes bacteria from the child to mother. The mother then produces antibodies to this bacteria and passes the antibodies back to the baby via the breast milk.
Tom's really good. He helps lots around the house, and he cooks and he does the cleaning, and that's about it.
The disintegration of the nuclear family and the decline in breastfeeding over the past 100 years means that new mothers often can't rely on family or close friends for help. Child rearing, once a job shared by the extended family, is now often the responsibility of a mother and sometimes a father.
Motherhood can be a really big adjustment at first, especially when you're breastfeeding. It takes a lot of time. You can often feel very isolated, and sometimes like you're not contributing to the rest of the world, like your total focus is you and this newborn. It's important to recognize that what you're doing is important, and for you, for the baby, and that it will pass and you will get an opportunity to get back into the real world.
Human breast milk provides so many advantages, which can be seen both from the society, from the mother's point of view, but most importantly, from the infant perspective. From the point of view looking at the society benefits, we have a much lower incidence of infections in the newborn, a lower incidence of diseases such as juvenile diabetes, lymphomas, leukemia, and perhaps other diseases that are prevented, such as allergies, or their onset is delayed in the breastfed infant compared to the formula-fed. As far as the mother is concerned, the factors which are beneficial to her in breastfeeding are a lower incidence of cancer, both breast cancer and ovarian cancer, and the important factor of the mother-infant bonding, which is beneficial both to the infant and to the mother.
When a woman breastfeeds, she's in a unique anovulatory hormonal state that appears to sharply reduce her chances of contracting breast and ovarian cancer. Many northern people intersperse pregnancies with years of nursing. Until recently, breast cancer was virtually unheard of in their societies. As they adopted Western ways, including infant formula feeding, the incidence of breast cancer grew accordingly. The anovulatory hormonal state that reduces a woman's cancer risk also reduces her fertility. For a mother whose baby is less than 6 months old, is exclusively breastfed, receives no solids or supplements, is breastfed regularly throughout the day and night, and if the mother has not resumed menstruation following delivery, the chance of becoming pregnant is less than 2%. Once a mother's menstrual periods have resumed, or the baby has started solids or supplements, a breastfeeding mother's fertility returns, and she may want to discuss family planning options with her doctor. Despite the overwhelming benefits breastfeeding offers, many women find breastfeeding difficult to sustain in an unsupportive society. Mothers struggling to breastfeed have few role models and little support. Many women proficient at breastfeeding at home find the idea of nursing their babies in public daunting.
There was a time when I was with my girlfriend and we went to a restaurant, and as soon as we got in, we sat down and he started to get a little bit fussy. It wasn't that I was getting bad vibes or anything. It's just after the 25 years of knowing that good girls shouldn't lift their shirt in public. Whatever, I just couldn't do it. And so I proceeded to go to the washroom and feed him there.
I think it's very interesting that in our society that breasts are used to sell a number of things. You see breasts used in beer commercials, and you see breasts used in clothing or lack of clothing commercials, and just the connotation that society has on breasts. But to see a baby at the breast, and especially in public, you still see very many that still raise their eyes and wonder what on earth you're doing and how old is that baby and so on. And so I think it's important that we discuss some of the aspects of nursing in public. And part of that in enabling mothers to do that is the support that they have to know that that's okay to do it, that this is part of what's normal and what's natural, and this is as it should be.
A support group can be any kind of informal gathering. Expectant mothers can gain information, and breastfeeding mothers problem solve with other parents.
I always found it fairly easy to breastfeed in public if your wardrobe just has to be exclusively two-piece outfits. That's so you have a top that you can lift up. I've never really found a place where I couldn't nurse a baby.
I haven't found any problem. I know that I just look around to see what environment we're in and making sure that the people who are around wouldn't be offended. And if they are, I sort of say, well, that's too bad to myself. Right, but I do want to make sure that we're not in a situation where somebody would find it really offensive. And so we don't try to hide the fact, but we try to be a little more discreet about things in public.
This is discreet nursing.
This is one way we do a lot of nursing. Actually, we sit on Chesterfield usually, so she can sit beside me. And we read books, don't we, Jennifer?
Yeah. Just hang on, sweetheart.
That's a really easy way to nurse and do something else as well. And also kind of, you can use the book as a bit of a camouflage for yourself, too.
I encourage the moms to sit in front of a mirror. And just what Peggy was saying, wearing something that's two-piece, where it can be lifted up and you can position the baby and look at yourself in the mirror and, well, what are people really seeing? And then when you become comfortable doing that, then you realize very quickly that it's something that you can do. The challenges do come as your child gets older. We know that they become more active at the breast because there's a lot of development going on that's not just nutrition that's happening at the breast. And you see them as they get older that the hands come up and they like to play with your earrings or your hair or your necklaces, or they're more social where they may be nursing and they hear a sound or someone talks and they pull off the breast to look around, and that may be at the same time the letdown reflex is happening, and you're trying to hold the milk back while the baby's looking around and get the baby back on. So there are different challenges. And when you're nursing a toddler at the breast, you still see your baby's face in that little face, and you kind of forget about the 3 feet that's hanging down here, but society gets caught up with the 3 feet hanging down here.
I've certainly been in situations where people have told me that they're not comfortable me breastfeeding in front of them and have asked me to leave the room. With my first baby, I found that I would give in to those requests to leave the room. And now, after 6 children, I ask people to leave if they're not comfortable.
In a baby-friendly society, women would be supported in their choice to breastfeed. Businesses would have on-site daycare. Employers would be flexible for a few months to allow mothers to take extra time to express milk. When returning to work is necessary, some women may wean in the mistaken belief that breastfeeding would be impossible.
Well, Saoirse's 10 months old when she started going to daycare, and my concerns weren't so much how she was going to cope. I was sure she was going to be fine socially and interact well with her caregivers, but I was concerned about myself missing her, and I was also concerned whether I was going to be able to keep up with the breastfeeding. It was really important for me to continue with the breastfeeding because there's severe allergies in the family, and I wanted to breastfeed for that reason up to at least a year, or if not longer. When she gets up first thing in the morning, I go in and I feed her first thing, and I usually try and feed her on one breast or the other, and then when she's done and she's had enough, I put her down to play, or I put her in her high chair to have, a bit of rice toast or something, and I pump my other breast. And usually I get about 3 ounces of milk, and depending on what my milk supply is like, I'll either freeze that for later, or I'll take that for the daycare day. And if she's going through a growth spurt, or her appetite is changing and she's wanting more milk during the day, what I do is I bring extra baggies of breast milk, and I put those in yogurt containers, and I take them into the daycare, and they've just got them lined up in the door of their freezer, so if she needs more, it's there.
Good morning, Teresa.
Good morning, Evelyn.
How are you?
Good.
How's Saoirse?
Good. Here's Saoirse's milk.
Okay.
And here's her other bottle for the day. Put it in the fridge. Okay. Bye-bye.
See you later.
Between 4 and 6 months of age, a breastfed baby's iron supplies become low, and he is ready for iron-fortified infant cereal. Babies are ready for solids when they develop hand-to-eye coordination and lose the extrusion reflex, and are therefore able to swallow their food. It's important to realize that breast milk is still very important. A baby at 12 months of age, taking a variety of solid food, still requires breast milk daily. And between 1 and 2 years of age, breastfed babies generally begin to wean themselves. The gradual decreased demand for breast milk from the baby results in a gradual decreased milk production from the mother.
Our 2-year-old is doing fairly well with the twins. I nursed her till she was about 16 months old, so she does remember breastfeeding and has helped me a bit. She'll hold my breast while I'm feeding the babies. She'll play with her own breast sometimes. And the other day she was breastfeeding one of her dolls. She's been a bit jealous, but I find that the more I allow her to be involved with the babies, especially around their feeding times, the more relaxed and accepting she seems to be of them. I gave all 6 of my children breast milk, and it's a wonderful feeling. It's a wonderful gift to be able to give them. Despite all the hard work and the time commitment, when you've got them latched on and they finish their feed and they fall off with that drunken look on their face, it just makes it all worthwhile.